Good afternoon, everyone, and welcome to Webinar Wednesday. We are excited to welcome Dr. Deanne Ginsberg. Dr. Ginsberg completed her residency in obstetrics and gynecology at the Bauman Gray School of Medicine in North Carolina. As her career advanced, she developed a special interest in functional medicine and the manner in which it bridges the gap of a patient's illness while minimizing severe symptoms and optimizing health. This passion now encompasses special focus on the understanding of genetics and methylation, optimal hormone balance, and overall healthy aging. Dr. Ginsberg has used her extensive experience to help men and women with hormone imbalance regain the vitality and fitness they thought was lost forever. She lectures for Functional Medicine University on the topic of PCOS, its natural reversal, and pathways to fertility. She is the author of the PCOS Environmental Roadmap. Rectangularization of aging is her personal passion, and she is faculty at the American Academy of Anti-Aging Medicine, where she has lectured about bioidentical hormone replacement and telomeres and how instrumental their preservation is for ongoing health. She is also involved in a groundbreaking infusion study looking at young, fresh, frozen plasma and the effect it has on helping reverse symptoms of multiple sclerosis and Parkinson's disease. Thank you so much for being with us, Dr. Ginsberg. Please begin when you are ready.
Okay, well, thank you so much and welcome everybody. I am in Houston, so we're an hour before anybody that's more on the East Coast. And the good news from Houston is that we've thawed. And if you are starting a plumbing business, you have a lot of people that need you out here. So other than that, it's a good day. But we're all in one piece. And I wanted to talk to everybody lunchtime today about something that I'll bet, because I know I see a lot in my own practice, that you see on a regular basis when you're prescribing bioidentical hormones. The biggest thing I will see is a patient will come in, and if they don't feel good, they're in their late 40s, early 50s, their periods have gotten irregular, you know that estrogen helps your brain, your heart, your focus, it drops your inflammation, it keeps your bones stable, it keeps your skin looking good. So you know the appropriate estrogen progesterone balance is going to help this patient age well. The problem is immediately coming out of her mouth from the Women's Health Initiative study is she goes, wait a minute, they're going to cause cancer. Problem number one. Problem number two is I still see physicians in Houston and even places I talk that they'll say, well, I don't use hormones anymore. They cause cancer. So if you look at the medical literature, and one of the greatest things about doing a talk is that you really look at the latest literature. It is full of information on estrogen benefits and information about how breast cancer is a problem based on what the system is doing when it interacts with estrogen, and how detoxification becomes a problem of creating more inflammation if your detox pathways don't work and you wind up then estrogen dominant with inflammation, creating malignant cells that go on. Metabolic syndrome, there's a ton of things that really link to that. And that's what I want to bring you today. And I want to show you how you can do a little bit of hormone testing and look at the metabolites while you're educating your patient to get her microbiome in line. The take-home message from all of this is that the microbiome of women with breast cancer, the gut bugs and the products they make, is very different than women that don't have breast cancer. And it's really important for that message to get across because we take control of our own health. And when we keep that in line, we only get the positive benefits of hormone replacement or anything else we're doing. So I thought this was an interesting way to look at bugs. And I had to look up what pointillist is. And it basically means a bunch of little dots that get put together, and they're put together so close and in such a way that they make a picture. So if you think about it, you know, we have the genetics of an earthworm, our own genetics. We use the bugs. We use what they offer us to build ourselves, create energy, and then keep our system functioning. All right, so we know the benefits of estrogen. If you go to PubMed and you look up estrogen benefits, you're going to see lists and lists of studies that are shown that what you do is when somebody starts to hit that menopausal transition, that you get them started. It helps their brain. It helps everything that we talked about. And you will do better if it winds up with, and I'm going to take questions at the end. So everybody keep, sorry, I just saw a question. So keep and put the questions in, because I'm going to go ahead and take questions at the end and I'll go over everything. So for the person that just asked a question. So what we want to do is we want to make sure that we look at what the literature shows about healthy estrogen, and then what we can do to offload to keep everything in line again. So we know the benefits, we know what PubMed says. What do we know about what creates problems? So we know that most of us in our Western world, because of our diet, chronic inflammation develops, right? We know from disease that gut microbiome, or I should say gut microbiota, right? Because the microbiota are the bugs, the microbiome includes everything else, are a major kind of modulator or conduit in the inflammatory process. They will increase it or decrease it. Our immune system, as we know, hits a certain point and then goes crazy. So the basic concept is when oxidative stress and chronic inflammation blow the system up, there's no turning back. And that's where malignancy develops. And it's a very simple concept. And I think most of us physicians, as physicians, understand that. But believe it or not, patients don't. They don't get it. They can't look down at their diet and lifestyle and see how that can contribute to illness. Sometimes they don't want to. I tell people sometimes they got to give up gluten, and you'd think I told them they got to live homeless on the streets. So it's really important, and I hope you guys can use some of these slides to let patients know that lifestyle and inflammation is really what's going to drive cancer. And what we need to do is minimize that interaction to keep the cells stable. All right. So right now, very interesting. Current knowledge can't explain why some people develop cancer and some people don't. Only 50% of people with the BRCA gene ever develop breast cancer. So if that was going to determine 100% of your pathway, say, into malignancy, then everybody that has that gene should develop it, and they don't. So it's an environmental something that is going to send us down that road. And then recently, people have linked the classic bacteria that we have and malignancy that develops. So effects of the microbiota on local and adjacent neoplasia present in the estrobolome, the estrogen metabolization part of the microbiome, and the interactions that go awry that create a problem. And everything here comes straight out of PubMed. Okay, so the question is the microbiome and the breast cancer link something new, or have we known about it for a while? And now we just really need to take a step up and say, hey, patients and people, let's go ahead and get on top of our gut to keep the system healthy. So this is a really good review article that linked everything together, looking at mechanisms of how the microbiome and the estrobolome, when not running efficiently, will increase breast cancer risk via inflammation. The impact of the altered composition of the three major biomes, right? The breast, the gut, and the microbiome itself, and how it affects the normal breast, converting into breast malignancy. And then the study looked at that we can see there is growing evidence that the altered populations will hinder chemotherapeutic treatment, meaning even if you've got somebody that develops cancer, when you go ahead and you try to treat them, if their gut's not in place and their bugs aren't balanced, epigenetically, they won't respond to the treatment. So it's really making sure that the system is as balanced as possible at the gut level. All right, so the gut microbiome itself, right, is the microbiota, the bugs, the products it produces is the microbiome combo. The crosstalk between the bugs themselves and the host, and very important, the composition. That's where the big key for the breast cancer help comes in. The composition and the abundance of each specific gut bug group determines how well the immune system is going to fight off a malignant cell. Progress in metagenomics, right? How our genes are affected, have realized that diversity and abundance and what that state of being is going to determine the sickness of the individual should it develop. I just wanted to kind of show everybody that there is tons of literature behind this showing that it's not the hormones are a problem, it's what they're bathed in. So on the planet, right, we have boys and girls. In the gut, we have Bacteroides and Firmicutes. And the way I kind of understand this myself is that the Bacteroides contain the lipopolysaccharide. So it's almost like if you have a bacteria that's an egg and the egg only has white in it, that's a Firmicute. If it's got the white and the yellow, that's a Bacteroides. Not a problem as long as the shell is whole. But when you crack the shell, which you do, yes, even when you eat good food, you kill bugs no matter what. But when you eat more inflammatory foods, you crack even more shells and you release more egg yellow. When you eat more, when you release more egg yellow, you're going to get more of that lipopolysaccharide. So you're going to get more of an endotoxin inflammatory problem. So it makes sense. If the Bacteroides and the Firmicutes are balanced and you kill bugs, if the ratios are okay, not only have they created the baseline, what we need, but you're not putting too much egg yellow into the gut to create more problems that the body can't recover from. Chronic inflammation, neoplasia. And I'm going to show you that in the future slides. So the gut bugs make short chain fatty acids. That keeps the lining intact. Remember, as we get older, gut microbiome diversity goes down, short chain fatty acids go down, repair doesn't function as well. So detoxification becomes an issue. And so if we keep the short chain fatty acids and the bugs where we need them to be, detoxification stays in line, breast cancer risk goes down, and should you develop anything, recurrence and mortality goes down. So some basic info about the gut, right? Science has shown that there is a subset of gut bugs that actually detoxify the estrogen. They metabolize it out, and when they are off, they are related more in the group of women that actually have breast cancer. So research says that microbiome diversity is really important. In what way? It's what bugs you have. More important as a cancer risk and promoting factor than the microbiota even composition is the functionality of how it works. So again, it's what balance is there and what the bugs themselves are doing, how they're repairing the gut, which enables the estrogen to be detoxified down the right pathway. And anybody that's giving any kind of hormones has, I'm sure, seen this pathway, but I always like bringing it up just to do a short review because it's, and I think this is a really good slide to show patients. Remember, estradiol, cholesterol based, you can't pee off cholesterol, you convert it into estrone, and then you'll go down your three pathways. Yes, it's a genetic factor that there are some people that preferentially make the more toxic hydroxyestrone. Some people do. Some people also have a mutation in their COMT enzyme. So if that's the case, they're going to detox slower. It's just a fact. So the key of what we want to do, because we can't change genetics, and I don't get a lot of genetics on patients because I think people then get hung up on that. They'll go, oh my God, I have an MTHFR, that's my problem. Or I have a COMT, that's my problem. No, if your genes were that bad, you'd be dead. So the fact that you're alive means they're functioning. It's just if they get pressure on the system, it's a problem. So if diet's an issue and inflammation becomes a problem and the COMT can't do her job, or you don't absorb enough B vitamins to do the job, then you'll wind up, this guy can't offload, and you'll get the backup into this. So you'll make that toxic inflammatory estrogen in the light of a poor offload. This is a great take-home message. The two main things that create a healthy gut is the diversity in there and what's called temporal variability. The more dysregulated you get with everything. So I guess it's kind of like racing, right? You want to get that heart rate. You don't want your heart rate, if you're running, to be 180, then 120, then 150, then 200. What you really want is to get into that good, healthy heart rate zone and carry that. So temporal variability is just how stable the gut bugs can maintain themselves when the situation's off, right? So something comes down food-wise, bugs die, lipopolysaccharide increases, certain other bugs die. You want them to get back in line again. The more you can get the human body back in line again, the healthier you'll be. So high diversity, lots of different guys, low variability, the more stable the gut is. And that's straight out of the mouth of the PhDs in microbiology. Okay, so I've used this slide in a bunch of other talks I've given, and I absolutely love it because it's so clear. Rob Knight is a PhD at the Microbiome Institute in San Diego, and I think this just says it all. And I thought it was really interesting because the number one thing that affects your microbiome is the different types of plants you eat, period, followed by age. So one thing you have to tell your patients is that as they get older, their microbiome diversity is going to go down. It's just a kind of a tough luck scientific fact. Now, we can do everything we can to parallel that. I thought it was interesting that exercise was low, and even sleep was not high up there, although sleep is super important. But what it really goes to show you is that as you age, the diversity is going to go down. If you don't feed them right, the diversity is going to go down. And if you give them gluten and dairy and inflammatory peptides, and they have a little bit of a genetic predisposition to inflammation, not even celiac, but a lot of people will react to the pesticides and everything that gluten is sprayed with. They'll get that irritable bowel, even if they don't have a formal diagnosis. And even without a formal diagnosis, what's going to happen is they're going to have, okay, I poop every 3 days, or I get diarrhea right around the time of my period. That gives you an idea their microbiome's not optimal. Now, when they start getting estrogen dominant, they're going to get into trouble. So here's a study where they looked at, and I think this says it all, they looked at peeing off estrogen depending on how many bugs you got. It is more extreme in postmenopausal women. You can see that you pee off more estrogen the more different bugs you have. And the Shannon index is the percentage of diversity. So the more non-specific diversity you have, the higher your Shannon index, the more you pee off estrogen. It's not quite as dramatic in the premenopausal woman as it is in the postmenopausal women. But my suspicion with postmenopause, and if you read the study, they don't say it super clearly. They're probably talking about women here that haven't had a period for a year, just by clinical definition, right? Because there's no black and white of exactly when your labs are postmenopausal. So here you're comparing estrogen fluctuations with no estrogen, which is why I suspect you see more variability. But as estrogen drops and inflammation goes up, you're going to find that those gut bugs change. So the better shape you keep them in, the better you're going to pee off the bad estrogen. This is the same thing, but reverse, right? The more urine estrogens you have, the less in your stool, which is the more you've peed off, right? So here, the lower your beta glucuronidase, or the higher, I should say, your beta glucuronidase, the less estrogen left in your stool. So beta glucuronidase is an enzyme that keeps the bugs balanced, but it also conjugates estrogen. Bugs get out of whack from the inflammation in the system. The beta glucuronidase goes up to try to rebalance the bugs, and it becomes a spinning water wheel. So instead of the estrogen offloading, it almost gets whipped back into the system. So again, when your beta glucuronidase is dysfunctional, so will your amount of estrogen in your stool. So the more beta glucuronidase you have, the more you'll pee and poop off. And again, the more urine estrogen you have, the less you're going to have in your stool. So just the take home of this is the state of the microbiome and the enzymes that surround it are going to determine how you offload estrogen. Where I want to apply this to clinical stuff that you can see every day is when you look at your urine hormones. If you look at a woman in her 20s and her 30s and her 40s, you do a 24-hour urine collection, you're going to find that the average woman is going to pee off between about 2.5 and 11 micrograms of estrogen in a 24-hour period. The green here, the 4.6 to the 7 is the first standard deviation, say 50 to 60%. The 2.5 to 11 is is about probably 90%. In the 20s, 30s, and 40s, the estrogen amount stays about the same. The reason a woman at 47 can't have a baby and a woman at 27 can is because the brain integration of the ovaries and the brain itself starts to fall apart as the telomeres shorten. So when you're replacing hormones, you look, and this is my particular urine, I was 55 when I did that. So remember, it was 2.5 to 11. So the estrogen in a menopausal woman is 0.3 to 3. Boom, that's the drop, right? So you want to get that woman theoretically a little closer to Judy 47. So you want to drive her to about, 2.5 micrograms. So what you can do is get the estrogen up to where you want it to be, and then look at the byproducts to make sure she's not making too much of your bad guy. Make sure her total potent estrogens aren't too high. And now you're comfortable with her balance. She's not making the bad stuff. Well, what's going to determine that how she does well here? It's not just the amount of estrogen you give her, it's how the microbiome offloads it. So you've got a clinical monitoring tool while you're telling this patient to get her gut in line. So again, how do we get it back in line? And it was very interesting because as I was writing this talk, I said, geez, it just tells you to eat right and exercise, which is really the answer. But I wanted to give you a bunch of slides that you could kind of put in front of patients because everybody thinks they eat healthy. Nobody comes into your office and says, oh man, I'm eating Cheerios for breakfast and pizza for lunch and macaroni for dinner, and that's really bad. Most people think they eat clean, but I think that they don't realize how many nutrients are out there. They just don't. They're eating out or they're running through the grocery store. So it's really important for patients to understand what they can do. Okay, so number one, what does inflammatory foods do? What is the problem? So what they will do is blow up the gut, mess with the estrogen metabolization, create inflammatory estrogens, increase breast cancer, and increase the metastatic potential. Why? Same as I showed you in the study. Standard American diet increases unhealthy bugs. Beta-glucuronidase increases to get the bugs in line again. Deconjugation of estrogen, boom, back into the circulatory system. So instead of offloading it, you're water wheel whipping it back again. And now the old guys, the new guys, 6 months from now, 5 months ago, all bind together, you wind up with that estrogen dominant state and a creation of bad estrogens. Here's how leaky gut processes right into breast cancer. So, right, gut bugs get out of whack with diet being a problem. They wind up making less of their short chain fatty acids. So therefore, you develop lining breaks, right? Increased permeability. So harmful inflammatory products through leaky gut wind up in the circulatory system. You're going to get more inflammation causing a problem. Number two, what's going to happen, and a lot of people don't realize this, is that when these bugs are out of whack in your gut, digestion becomes a problem. Why? Can't do their job. Big triple fat bonds can't get broken down. Bugs start breaking down just glucose. Patient becomes what I call a sugar burner. She can't break down fat. She just starts breaking down glucose. So she winds up with blood sugar dysregulation. And classic, right? LabCorp says your glucose is 99, you're abnormal. So if your glucose is 97, of course, the patient thinks she's normal. She's got, again, not pathology because she's not 99, but that's clearly a problem. So now glucose is dysregulated, insulin's dysregulated, insulin will bind to some of the sex hormone binding globulins, and the sex hormone binding globulins drop when it sees all that blood sugar. Now you're increasing estrogen availability. So if you draw SHBG on everybody and you see them less than, say, 35 to 40, even if all the other numbers are normal, she's at an increased risk for a problem. So, okay, so now let's go into the estrobolome, right? In the diverse human gut microbiota, you have your estrobolome gut bugs. They want fiber. When high fiber diet is consumed, estrobolome increases, estrogen's eliminated, and not fueled by the estrogen that gets left behind. And I just put a bunch of things here, and I'm happy to send if everybody wants. We have a great handout that's got glycemic index, root veggies, but then it's got another list of your non-starchy vegetables that people can walk into the store with their cell phone and say, oh, I don't know what kohlrabi is, and they can Google, how do I cook it? So daikon radish, microgreens, coyotes, things that people have never heard of, they add varied to their diet, and that's going to make the estrobolome happy. Always remember, it's a symbiotic relationship. The bugs don't have to stay. They stay because they choose to. Feed them right or they're out. So the more fiber we give them, the happier they are. Here's just good proof to show your patients that there's an increase in cancer with metabolic syndrome. And you can just see that breast cancer goes up when blood sugar and dysregulation becomes a problem. And you're not even calling these people diabetic. You're just calling them metabolic dysfunction, low sex hormone binding globulin and dysfunctional blood sugar. So it's not all about the estrogen. It's what it's bathed in. Same thing here, right? We eat, we elevate glucose, we use what we can, we then elevate, we then stuff leftover glucose in our cells with insulin. After we elevate the insulin, the cells secrete leptin, the fat cells secrete leptin, talk to our central nervous system, tell us to stop eating. This enables the bird to still fly and the squirrel to get up the tree. We then drop our fat, drop our leptin, the body's hungry and it goes out and eats again. When you get dysregulated, leptin's elevated. You can check that at your LabCorp request. We want people to live with a leptin of about 12 or 13. Chronic leptin elevation, non-specific elevated blood sugar elevation with insulin. You're going to increase all your inflammatory modulators. The macrophage is up. You can see chronic dysregulation between the fat cells upregulates the cancer cell and the cancer cell grows. And that's why people say cancer feeds on sugar. It feeds on the inflammatory dysfunction. All right, so what can you tell your patient? Because then I'll get this. Oh my God, I'm never eating carbs again. But that's not sustainable. Now, do you have some people on keto? Yeah. Do you have a handful of people that they'll stay on keto indefinitely? I don't know how long indefinitely is, but I got a lot of people go, oh, I'm not eating carbs. Please share with them that there's a lot of good carbs that they can eat. Because I tell people you can't eat gluten or don't eat grains and they think they're going to die. What can I eat? So there are carbohydrates and vegetables. Please remind them. And here's what I try to send everybody home on. Because now you're in your office, you've had this conversation, you got to get out the door to see your next patient. Here's a really good way. Hand them this, give them an idea that there's carbs and vegetables, tell them to get their veggies in this way. Half a cup of seasonal fruit. And if you've got somebody real high on blood sugar, even them, tell them stay away from their melons, but let them go with the seasons. A cup and a half of salad with the unusual stuff, right? The colored flowers, the fennel, the snow pea shoots and the Easter egg radish and the watermelon radish, all of that stuff goes into the salad. A cup of their more starchy root veggies, and then 2 cups either convection roast or cooked of the non-starchy guys. Most people are not getting anywhere near that, and that's going to feed the good bugs to offload the estrogen. Carcinogenesis, PubMed paper, is fueled by obesity, right? Midsection fatty tissues create inflammation. They increase estrogen production. The sex hormone binding globulins, remember, the cycling mechanism was designed by Mother Nature for hibernation, straight out of PubMed. Unfortunately, winter never comes. So it just continues to build on itself. One of the big problems sometimes too, again, and I go back to labs, is that the lab reads abnormal when you hit up here. By the time some of those numbers are up there, the patient is really sick. Now, patient's going to say to you, I don't have time to work out. My life's too busy. Everybody can come up with 7 minutes. And this was, I think, Johnson & Johnson. You can go on your app and you can Google scientific 7-minute workout. And it's basically 14 workouts in 7 minutes. It works great. They can do it in their office. They can do it at home. The lady says, are you ready for your 7-minute workout? And they'll do like 30 seconds of jumping jacks, and then you rest 5 seconds, and then 30 seconds of a wall sit and rest 5 seconds. So it's movement. It gets people started, because it shocks me how many people were overwhelmed with exercise. It also shocks me how many people that had more time at home exercise less with COVID. So you got to start somewhere. It's a good, easy start. Same thing with yoga. I'd follow Cassandra. She's got tons of yoga that's free. You can have somebody that barely has moved and you can tell them do 10 minutes or 15 minutes in the morning every day. You can get to a point where you're doing the advanced stuff. It's in your house. It's easy. It's at your own time, your own pace. And almost everybody can do it. Start them somewhere. It starts them moving. Move the gut, get the vegetation in there, little bit of balance with all of that together. And then here's what I do for people that you feel their gut's really upside down while you're waiting for testing that you're doing, or even if you don't want to do gut testing, just 4 easy things you can do to get the lining and the bugs back in line. Number 1, tell them to chew their food, get it digested so the stomach acid can get around it to break it down. Add digestive enzymes if you feel that they're gassy or they're more bloaty and you want to give support to the breakdown. I don't use a lot of betaine in the digestive enzymes. I tend to use more digestive enzymes that contain protease and bromelain and pepsidase and pancreatic elastase. Betaine sometimes will give people a little bit of a stomach acid feel, like a burn. So if somebody's real delicate, kind of back off on the betaine. And then if their gallbladder's gone, you can add a little bit of extra fat digestion support. And then glutamine, you can use it in a powder in a pill, and then a little bit of an IgG binder. And there's a lot of companies that make those. And sometimes you can put the powdered glutamine and the IgG binder into a little bit of a smoothie, and then you modulate the immune system with pre and probiotics. So this is just, again, I wanted to give you some things because I know I find a lot of new patients, they come in, they may have testing, they're overwhelmed, they're questions about hormones, and you want to kind of send them out the door when they tell you that the estrogen is going to be a problem, with how they can balance their gut as well as what they can do to stay healthy in the long run as far as getting rid of the estrogen. Vitamin D, this is sort of my protocol. I just tell people drops give you flexibility, take it around dinner time. So 30 to 60 minutes. Again, this is stuff to just tell your patients to make it easy, because the classic is my doctor drew it, then gave me the 50,000 pill. They take it for 3 months, their D's normal, and then they stop taking it. And I'm like, well, wouldn't you have gone back to where you started? Patients just don't get that. So tell them 30 to 60 minutes, lunchtime, lots of skin exposure. They don't need any. A little bit, short sleeves in a t-shirt, give them 2 to 3 drops, no sun, 5,000 or 5 drops, and you generally won't get yourself into trouble. Just a good balance. Make sure that their nutrient deficiencies are taken care of. Like I said, you focus on blood sugar and fat digestion, work on circadian rhythms. The bugs need circadian rhythms balanced. So sleep, very interesting. There's a guy named Matthew Walker who's a real big sleep expert in California, and he'll tell you sleep is really important. Focus on what it does and make sure that you try to get, 7 to 8 hours. But remember, you're not going to fall in bed and fall asleep right away. So sometimes you need 10, 15, 20 minutes to calm to then get your 7 hours. But I think circadian rhythms are underappreciated for how the gut gets back in line. So again, when you give your patients your hormones and it's going to help them significantly for the rest of their life, what they have to understand is it's not, oh, that's going to make me fat, or, oh, it's going to give me breast cancer. It's the body's changing. And with aging, you're changing. And what can you do as much as possible to maintain your health throughout the changes in life? And I think we can get people healthy without worrying about malignancy. So I've got a bunch of questions up here, which I am happy to take. And if I can't read them, Lindsay, you can help me a little bit.
Sure, absolutely.
Oops. Okay, now I can see them. Now they came up.
Perfect.
Okay, so I'm going to start in the beginning. Is the oral microbiome significant in the development of cancer? I think it's a connection all the way through. The way I look at it is that you're a big tube, right? Skin goes up into mouth, goes down into gut. It's just one big tube. That's why gut dysfunction will create issues on the skin. So it's all together. So I think that you work on good dental hygiene, which I think people don't do enough, and I'm guilty of that. I try to floss and brush and do all of that, but I think that the oral microbiome is just as important as the gut microbiome. There's a couple new toothpastes that have botanicals in them. There's one company that makes a really good botanical paste, and I think, Lindsay, I'm allowed to use companies right now that I just happen to like.
Yes, absolutely. This is non-CME.
Okay, so I happen to use Biocidin. It's called Dental Cedin. It's by Biobotanical. That stuff is amazing. They make Biocidin that a lot of people use to treat patients, but the Biocidin toothpaste is great. And what you do is you use sort of the Dental Cedin. You put it on your toothbrush, you brush your teeth, and then do not spit it out. Swallow a little of it because it's got lavender and golden seal and uva ursi. I think it's got all good botanicals. Swallow a little for your microbiome. Then what I do is I water pick with it. So you kind of get it in between your teeth and then you swish and you spit the rest of it out. But it's Dental Cedin by Biobotanicals and it's wonderful, good oral microbiome. And I've seen my kids' teeth get whiter. So love it to help. Can you tell us what the Firmicutes Bacteroides ratio should be and what it means if it's high or low? Okay, you generally have more Bacteroides than Firmicutes. That is us, period. And so what happens as we get older is that the Bacteroides percentage increase. So unfortunately, we increase the lipopolysaccharide content. And there's a balance that's there relative to the human gut. You know, here's the problem with probably any testing. When I go into my PCP or my cardiologist and he takes my blood pressure is 120 over 80 or 110 over 70. Well, the reason I know it's good is not from anything magic. It's just they know that the average person that walks in with that blood pressure doesn't die of a stroke. So almost everything we do, whether we're looking at thyroid numbers or estrogen in women in their 30s and 40s, the problem is we're only looking at what the perfect human specimen is. It's kind of the same thing with the gut bugs. So I use the GI map by Diagnostic Solutions. And I think that's even like any testing you're using is sometimes a moving target because every time somebody sends a test in, they probably rechange the numbers as the database gets bigger. So the big take home that you want to know is that the Bacteroides Firmicutes ratio should be higher in Bacteroides. It's going to get bigger ratio as you get older and the gut bugs change. You want to make sure that it's not too out of whack because that's going to be too much endotoxemia and the Firmicutes make you heavy. Remember, Firmicutes fat. So when the Firmicutes are higher, then you're going to see somebody with a little bit more weight loss resistance. So you want to kind of find that pretty good ratio. Like I said, the GI map does a good job. I know Microbiome Labs has a new test they just came out with that balances that. So as long as you're not too far out of that human norm, I think your balance is good. Can you extrapolate on data on estrogen metabolism from a Dutch test or other toxins in general? Okay, so I happen to like Rhine Labs. That's the test that I use. I've in my last year or so, as I've done more and more functional medicine, I wanted to go back and get a PhD in laboratory medicine and a PhD in physics, because that's really then going to help me understand the pharmacokinetics of how the hormones work. So that's probably not going to happen. So what I've done is I pulled all the old studies from back in the 90s where they looked at the pharmacokinetics of the cream that goes in, the metabolism that comes out, and how we're balancing everything. What's a really big issue is knowing the data points where you are. So you want to make sure that you get patients to rub their estrogen to get the estrogen in. You want to make sure that patients that are having disbalanced estrogen, you balance as much as possible in excretion. So what Dutch does is, again, what he took is filter paper, and he's using that as he extracts the estrogen out. That's my understanding of what the technology is behind it. And then what they've done is looked at people in that age range that they feel are appropriately balanced. And I don't know, I'm guessing he looked at maybe thousands of women in their 20s, 30s, and 40s. And that's how you come up with those parameters that he calls within normal. So if you look from one star to the other in the test itself, you're going to see, okay, in the urine, this is how much estrone you offloaded. This is how much glucuronidated estrogen you offloaded. So here's how you got to look at detox. When estrogen, remember, is made of cholesterol, and you can't pee out cholesterol, right? So you're sending it to the liver to be metabolized. What happens with the urine and the stool is, and here's a good way to look at it. The old water slides that we used to play on, right? Everybody goes up the steps, but there's a bunch of different slides that you can slide down. That's what estrogen detoxification is. So the estradiol is made, it goes up the water slide, and now it's been used, and now it's got to come out the liver. So when it comes out the liver, you're not just going to come out as estradiol. Some of it will come down the pink slide, which means that'll get glucuronidated and it'll slide out. Some of it will come down the green slide. It'll turn into 4-hydroxy 4-methoxy. Some of it will come down the 16 slide into estriol. So when you're looking at the Dutch test, or like I said, I use Rhine Labs because I personally just like their technology better. You're looking at the offload of everything. So it's how you're processing the fat soluble estrogen or toxins and offloading it. So when you look at the Dutch test, as long as I'm guessing from that, within the range that's comparable to a 40-year-old woman or a 30-year-old woman, and you're not super high in that 16-hydroxy or that 4-hydroxy, you know that your gut's okay, not going down a bad pathway. And it's really the same thing with toxins. You want to make sure you drive down the 2-methylation pathway as much as possible, and you'll do that when the gut microbiome is balanced. And that's really just understand that the urine is offloading all of these guys. That's why sometimes it's a little confusing to read, but I hope that cleared it up a little bit. Do we want more estrogen excreted in urine or stool? Doesn't matter. Doesn't matter. All you want to do is get it off. Your body's going to do all of that. So all you want to make sure is that you offload it and you're not recycling. So you're going down the 4-hydroxy pathway, which is going to free radical up the system. I usually tell people that 80-20 rule for clean eating versus cheats. Does this really lead to optimal gut health? Or do those one-off cheats mess up the whole system? Okay, here's how I want you to look at clean eating. Depends what your person has. All right, so there's 3 groups of people. And let's look at this in terms of, say, gluten. You could do sugar or dairy or any of that, but let's use gluten. It's an easy example. So the celiac people, great dinosaur grandma lived through a place where wheat was poisonous. So when they ate a little wheat and they got it in their system, they got bad diarrhea, they stopped eating it, so therefore they lived. The tribe next to them didn't have that particular gene, so therefore they died. They ate all that poison wheat, they died. And then maybe the people that had a middle of the road reaction kind of ate a little bit less and they passed their genes on. Well, the celiac people are going to pass that on because that was beneficial. Now, the problem in today's society is that that's not really a beneficial gene anymore. If that person who lights up that aggressively eats that food, if they come off the 100-0 percentage, they're going to get sick. And if some people will get a little more diarrhea, don't feel good. Maybe they don't know they have that celiac gene. So they got chronic inflammation in their gut. They're going to be in trouble. So for them, again, they got to stay pretty clean. The middle group people, you're going to see a variety. So some of them are going to blow up their gut enough with gluten that they may not have terrible gut symptoms. So now they show up in your office at 35 or 40. They got fatigue. They don't feel good. They've got arthritis. They've got joint pain. And you look at their antibodies and now they have Hashimoto antibodies. that person, every time they put gluten in on Friday or Saturday, they're going to really blow their gut up. So that particular person is going to make themselves sick. So I tell them, no, they need to be 100% off gluten and dairy. Now, they may find that they can have a gluten-free cookie or Bobo bar or Tate's gluten-free cookie. In other words, they can have a little bit of sugar, again, in your kind of 80-20 balance. But in that particular gluten situation, they got to be 100% clean. So I think what you got to do is you got to break down what your person has and then make sure that the stuff that's a little more dramatic to them, it's like the person that has an allergic reaction to peanuts, they got to be 100% away from peanuts. So make sure your middle of the road people stay pretty clean depending on what their diagnosis is. And then again, if that person is eating their variation and their fruits and their vegetables, they're going to be able to get away more with that, eating the little bit of the other, as long as they're truly not only clean, but good in variation in between that. And yes, it's difficult to tell people to eliminate things completely like gluten. I know even one high gluten meal is going to affect the gut integrity, echoing off my previous question. Yes, and I got to tell you, I got a kid in med school, because anybody that knows my story knows that my boys have very bad learning differences, that my gut was a mess when I was a resident and I didn't realize any of this gluten stuff. And so I delivered my kids. I had secondary infertility with my second baby. Both my kids have very, very late language, pretty significant dyslexia. My first baby didn't talk till 3.5. My little one didn't talk till he was 5. And they told me he was mentally retarded and would never talk. And it was pulling out gluten, cleaning everything up, the big kids in med school and the little kids in college. But the med school kid can't eat gluten, dairy, or eggs. It lights up on his food sensitivities and he gets brain fog. He doesn't feel good. So he doesn't. So my feeling is, again, is that adults and kids, you're not pulling everything away from them. But if you turn around and say, this is toxic for you, they need to come off of it. So you just got to create, have a gluten-free cookie, but clean the other stuff up. And problems with most people is they don't want to be bothered cooking and eating the vegetables. Get them doing that, and I think you'll be fine. I will have Lindsay send out to everybody. I'll send her a copy of our list, and she'll send that out to everybody. It's a good help to hand patients too. It's got a whole list of things that they've never heard of, so I'm happy to send everything. All right, talking about glucose metabolism, you mentioned less than 35 or 40 of insulin or SHBG. When your sex hormone binding globulins are less than 35 or 40, that's metabolic problem. And I like to run an insulin, I tell most people, about 4 to 8. Now, really interesting, somebody that is a huge gut mess and liver mess and a sugar burner, meaning they can't burn fat and they're using glucose as their primary source of energy, their numbers are going to be like 96, 97 at LabCorp or Quest. Their insulin is going to run low because the brain's going, I'm not storing this sugar. I'll never get it back out again. And the liver goes, I'm out. So their sex hormone binding globulins will be low, their insulin will be low, and their fasting glucose will be elevated. Those people are a fat digestion problem. Go to this slide that talked about chew your food and glutamine and digestion and probiotics and get them breaking down fat bonds, and you'll watch the SHBG come up, the fasting glucose come down, their weight will go down, they'll feel better, and they'll offload off the estrogen. When a person doesn't seem to tolerate prebiotic rich foods or probiotics, do you push through? Is that the best thing to do? The people that don't tolerate prebiotics or histamine problems, how do I know? I've been there. You name it, I've had it. When I was Ironman training, my gut took a hit and I had histamine issues. So remember, when you eat, you create histamine anyway. That's a byproduct of what your gut lining does in the breakdown of food. The DAO enzyme sits on the gut lining, so it breaks down the histamine. If you have a DAO mutation, you can have a histamine issue. But more importantly than that, what's going to happen is that when the gut lining gets beat up, the enzyme doesn't work. So what happens is histamine containing foods, prebiotics, kombucha, fish that's been left out for a while that's not super fresh, avocados, eggplants, wine, those guys are already high in histamine. So when you load that into their system, they're going to feel bad. Those people, do not give them prebiotics. They won't feel good. Sauerkraut, kimchi, take them off that. work on the digestive enzyme, put them on a low histamine diet, probably for about 6 or 8 weeks to kind of get away from that inflammation. Tell them in alcohol, because everybody goes, oh my God, what can I drink? Tell them they can drink a little vodka or a little bit of gin or a little bit of tequila, but even alcohol affects histamine, creates a histamine problem, but it's better, at least hard alcohol is better than wine. Get those heavy foods out, fix the gut lining, and then you'll find you can start back maybe with a little probiotic, a mild probiotic, maybe 2 or 3 days a week. And Seeking Health makes a histamine probiotic for those people, Ben Lynch's company, and give that to that patient kind of every other day. It's a gentle restart. So your histamine people, start on that. I think that will help. If someone already has breast cancer with chemo treatments, will correcting the microbiome have an effect? Absolutely. I see a lot of patients with breast cancer. I do the Rhine lab on them and I see where their offload byproducts are. And you want to know one of the big things that does? You sit down with that patient. The biggest thing, I think, having been through some medical stuff myself and all the things with my kids, is this helplessness and a hopelessness feeling. And I think breast cancer patients get a lot of that. It's so common. It's like, oh my God, I just got to take this chemo and I'm at the mercy of everybody else. If you sit down with a breast cancer patient and you tell them your microbiome affects this, and we're going to work on keeping you healthy, and you're going to change their brain waves. You're going to make them feel better. They're going to be like, I have a control over this. So they will eat. My patients do great. I do the Rhine every year. If you're a Dutch person and that's what you like, you can do that. They look, they see their metabolites are down. You can run a stool test. You can do micronutrients. You can do all of those things to work with them to maximize their gut microbiome and minimize their recurrence, whether they're on chemo or not. And I think you give them hope, you give them future, and you give them health. Absolutely. Do you feel beans an issue due to lectins, bananas, high glycemic index? Yet on your slide, you suggest lower glycemic fruits. No, what I do think is I think you got to keep it balanced. So I tell people, if I've got somebody that's got a fasting blood sugar of 97, and before patients see me, I get a 2-day food journal. So I look at what they're eating. And if I've got somebody that's complaining of weight gain or estrogen dominance or is worried about it, I'm going to put on hormones. And I look at those numbers, and because a lot of women, as they get into those perimenopausal, menopausal times, will complain of weight gain. When I look at those numbers and I see those fruits, those glucose numbers elevated, I tell them stay away from the high glycemic fruit unless it's after a big exercise. I still tell them take it easy. I can't tell you the amount of people that say, okay, my smoothie in the morning has mango and banana and a handful of spinach and a little bit of protein and some berries, and that's what they're eating in the morning. And their fasting blood sugar is 97. So I'm not against the banana. I think people lean in that direction too much. So I try to tell them that, especially in the beginning, stay a little more low glycemic, and that's going to help keep your blood sugar regulated. Then I give them digestive enzyme. I work a little more fat into their diet, so I'm trying to keep them a little bit more balanced. So again, it's a variety, and you'll see when I send out what I send out, we have a glycemic index with fruit. And what's really interesting, what's really high is dates. A lot of these people are eating the Lara bars like crazy, and dates are high in glucose. That's what makes them sweet. So it's really more to tip them in the direction of getting more varied fruits in that are not going to bump their blood sugar. And I don't, Gundry talks a lot about lectins. Beans, I think, and the lectins can be a little tougher to digest. So if the gut's not working right, if the migrating motor complex isn't working, so if you can't move that food through, you're not going to digest, right? So 4 things for healthy gut: diversity, motility, migrating motor complex, secretory IgA, immune protection, and immune modulation or immune balance. So what's going to happen is that if you've got somebody that's got gut dysfunction, the migrating motor complex isn't going to work, especially when there's protein that goes in. It's not going to be able to break it down and move it through, so it's going to sit there. So as it's breaking the protein down slowly, if you put some of the lectins on there or the stuff that creates more of a bloat, now the bugs will party in it, and I think you're going to get a little bit more bloating. So I try to be careful with that depending on the state of the gut. But I don't like to tell anybody, well, you can't eat nightshades, you can't eat lectins, you can't do this, especially long term. You may do it short term while you're getting their gut working, but then you add variability back and you can give them whatever they want. All right, for how long can we take pro and prebiotics and digestive enzymes? Forever. I think forever. So prebiotics, remember, are in food, or you can take a prebiotic. It depends who you are. If you're somebody that's eating a little beet kvass and putting some sauerkraut on your food, and I was the other day, I was in Austin visiting my son who's at Southwestern, and we went to a place to eat, and I got some kind of sweet potato, something that had kimchi in it. As long as you're leaning on that line, you don't need to take a prebiotic supplement. Microbiome Labs, I know, makes a prebiotic. So if you're not that food person, you may want to add a little bit of that. That's no problem long term. You're supporting your gut. Same thing with probiotics. I asked the PhD of orthomolecular, Dr. Williams, does everybody need a probiotic and for how long? And here's the way to look at it, right? Go to the smart people. You ask the PhD guys. He said, if you're outside and your body's balanced and the system is floating well and you're relaxing and you're meditating and you're doing everything that you need, then what happens is that you don't need a probiotic, right? If I quit my job, moved to Belize, sold surfboards, ate fresh fish every day, walked along the calm beach, wouldn't be a problem. Well, most of us don't do that. So we need some kind of modulation of the system. So prebiotics, probiotics, some people don't remember to take them every day. They're taking them 4 or 5 days a week. Stay on it indefinitely. And as you get older, immune system dysregulates, gut microbiome dysregulates. If anything, you need it as you get older. Same thing with digestive enzymes. I use Digest by Transformation Enzymes. I love their Digest or Digestzyme, but I like their Digest. And I also use their protease. Why? Because we're losing all of that with aging. Protease is expensive. The gut's got to work really hard to make it. So gut bugs dropping, right? Bacteroides increasing, more lipopolysaccharides. Now what's going to happen when you eat? More endotoxin. So you're going to get more inflammation. It's going to be harder to digest. Can't afford to make the protease anymore. So I think with aging, digestive support indefinitely is perfect. So prebiotics, probiotics, digestive enzymes, even for a healthy person, I take all of that on a regular basis just to optimize my health because I'm going to be 57. Some examples of IgG binders. I use SBI Protect, which is Orthomolecular's product. And I've actually experimented with that since I did have histamine issues and I was a little overtrained with my Ironman and delivering babies up all night. So my kind of protein shake that I make has like half a scoop of the SBI Protect and a little bit of glutamine and a little bit of choline. So I sort of use that as my anti-aging healthy gut protocol with the digestive enzyme. So that's one way you can go. And there's a little bit of IgG binder in mega mucosa. So what a lot of people do, what Dr. Krishnan will tell you, is take the mega prebiotic and the mega mucosa, mix it together in water in some kind of bottle, and then shake it up, and he'll tell you drink it through the day. And what you're doing is you're just cleaning up the mess, you're helping the gut lining. That's got a little bit of a sugary taste. They use stevia, I think, in it. So some people don't like the taste of it, but it's something that somebody can use 3 or 4 times a week to kind of help their gut, or you can use the SBI Protect and the GlutaShield when you need a little bit of a bigger binder. Which type of probiotics are best at surviving stomach acid and reach the intestine? Okay, I'll give you and the next person said probiotic is very important, how to choose the right probiotic for our patient. Here's what I'll tell you that I've learned from all the microbiologists that I've tortured indefinitely. There's 2,000, there's 2 trillion bugs in our gut. There's about 2,000 varieties. There's only about 4 major big groups that we've managed to isolate, capsulate, and put back in through a pill. The lactobacillus, the bifidobacter, the Saccharomyces boulardii, and the spores. And everybody's got a different opinion. The people that sell spores will say, well, they're better because they do this. And the lactobacillus bifidobacter we know is more in our gut. So the old story behind probiotics is from the soil and from the cow gut. Those studies back in the 50s are where that first development of what probiotics to give were used, what the cows were eating the grass and the bugs they were getting. Technology back then wasn't able to keep the bugs at the pressure and temperature they needed without refrigerating them, without keeping them cold. So now people associate, well, probiotics need to be refrigerated. They really don't. If you're going to a big pharmaceutical grade bazillion-dollar company like Designs for Health or Orthomolecular or Zymogen, they have probiotics at shelf temperature because they've created the capsule that can do that. If you read the back of the bottle or the back of the box, you're going to see most of them are a blend of Lactobacillus and Bifidobacter. The probiotics, number one thing they're going to do is they're going to modulate your immune system. So the guys in your gut are big wolves. And this was from Dr. Williams from Orthomolecular. They're wolves. They're fighting the environment and they're working as hard as they can to try to get stuff in line. When you send down the probiotic that you've grown in the backyard, that guy's a chihuahua. He's going to help a little. He maybe lives for 2 weeks. The biggest thing that the probiotics do when they go down is the immune system turns around and says, hey, who are you? What are you doing? While he's dealing with that new guy, he looks and goes, wait a minute, Proteus, you've overgrown. Wait, you're too much. Wait, Klebsiella, I got to knock you back. So there's a modulation of the immune system, a balance of the gut microbiome when the bugs go down. So any combination that you're using, that's pretty much what it's going to do. The Saccharomyces boulardii will kind of keep the yeast more balanced. And probably the biggest thing the spores do is they quorum sense, which means they look around really well and balance things. And they're very good for Clostridia. So somebody that's been maybe on a lot of antibiotics, or you see Clostridia on their stool test, lean toward the spores. The spores are your poor man's stool test. If you give somebody who has got a little bit of a gut issue a spore and they constipate, you know you got a gut problem. Then you want to lean a little more gentle to your Lactobacillus Bifidobacter balance. Most people will hit the spores a little bit more, again, once they've got a reason to go in that direction. But Microbiome Labs, Megaspore, a lot of people will do 2 of those 3 times a week with food. And again, Dr. Krishnan will tell you they're going to quorum sense, they're going to keep the C. diff in line. So what you're going to do is you're going to learn in your own practice. You're going to see people, again, the take-home message from this is go Lactobacillus Bifidobacter, and every other day, kind of in your real bad gentle people, you can increase it to every day and you can maintain them. If they do well on the brand that you like, change them. You don't need to change them up. You can move more to the spores again with C. diff, more diarrhea. They'll help people constipate up or tighten up a little bit more. And they're just a little more of an aggressive bug. But again, even a good balanced person can take spores 3 times a week and they'll do fine. It's really... It's kind of like saying, what's the best vegetation to eat? Yeah, you can rotate them around a little, but if you've got somebody doing well on them and their vegetables are good and they're happy on their probiotics, it's the immune system modulation you're looking for. For gut healing, you recommend glutamine, but it's so controversial in cancer. Patients get so nervous about it. I think that you just don't do it long term. And I think, again, you can do a low dose in somebody that's got some real bad gut issues. And I've read the literature, haven't seen a ton of that. In other words, when it comes to short-term use or lower doses, I don't know that I'd give somebody 5-6 grams of glutamine on a regular basis. But I think if you want to get their gut in line, if you've got somebody that's more anxious about that, then run their micronutrients, run their SpectraCell micronutrients, and then what you can see is where their glutamine is. And you can also do a GI map. If their gut looks good and you can get them on a good kind of basic food diet, you may not have a problem. But I know, again, the megamucosa, they run low levels of glutamine in that. And I think if you have questions with that, call Dr. Krishnan. He could probably answer more of that. But I'm not aware in low doses that you get into trouble. Probiotic maintenance on the gut, we did. More information on Rhine. Okay, so Rhine Labs, I kind of stumbled into. Dr. Frank Nord runs the lab. He's a brilliant guy, and he will be happy to talk to you. The big issue is, do you believe that filter paper urine is just as good as a 24-hour collection? And from looking at that and learning what I can from what I've researched and what the technology is. And like I said, I'm not David Zava and I'm not Mark Newman. In other words, I just know what I can learn and what I can learn from people. The technology of a 24-hour collection in pure urine and processing that way, to me, I'm getting a more real value. And what I really love about Rhine Labs, if you go to their website, you're going to see samples of Judy 20, Judy 30, Judy 40, and then the drop in Judy 50. So I'm really looking at, I use a lot of that even for my 20 and 30-year-olds that are convinced their hormones are a problem. I see tons of people that say, oh, I'm 25, I don't feel good, my hormones are an issue, I got a hormone balance problem. But meanwhile, their diet's a mess. So sometimes I run the urine to go, your hormones are fine, clean up your gut. So I just think they have wonderful technology, that the test is easy to read. I showed you kind of in my sample that it's very clear. They'll do all your estrogens, your detox, your progesterone, your DHEA, and it's kind of balanced in each person's, in each 10-year age group. So call the lab. They're wonderful. He'll explain all the technology you need, but I use it on all my patients. What I do with hormone replacement is I still use salivary testing. I think there's a place. Estrone in saliva will give you a little deeper detox at the tissue level. So what I do with everybody that walks through the door that thinks they need hormones is I do a salivary test. I first do their blood. I look at their FSH, their LH, and their estradiol and progesterone. Because remember, you can have an elevated FSH and still be making estrogen. And you want to make sure you're not making them more estrogen dominant, which is what the classic OB-GYN will do, because they don't check their estrogen. They just draw the FSH, assuming that means their estrogen's low. Then you have them spit. If that's elevated, run a detox, get them cleaned, then realize you've got somebody that's a slower detoxer. Work on their gut, get the bioidentical hormones in them, get them clinically comfortable, then 6 months down the road, run a Rhine test. You'll never go wrong. Food allergy testing. I don't love food allergy testing. We've used a lot of different ones. Cyrex has a wonderful food allergy testing, wonderful. Problem is it's very expensive. We used KBMO for a while. We're looking a little bit at MRT. I work with a nutritional therapy practitioner. Sheila will tell you Cyrex is probably the gold standard out there, and Dr. Vujani is brilliant, but it's just an expensive test. The problem I worry about with food allergy testing is remember what you're looking for. What you're seeing is a antibody that has made it into the bloodstream. That doesn't mean if gluten's not in your blood as an antibody that you don't have dysregulation in your gut relative to it. So I'm always careful about food sensitivity testing, because if you do that and that person doesn't have gluten in their bloodstream and you want them to clean their gut up, they're going to go, gluten's not a problem, and they just won't take it. They won't stop it. So the Cyrex is going to be really sensitive, but the problem is you're going to pick up a lot of other stuff. So either you're going to get the great, I can only eat water, or you may wind up again where you've got gut dysfunction, gut dysbiosis without having anything in the bloodstream. So as long as you've got somebody on board to get rid of the bad foods based on what they clinically look like, if the MRT or the Cyrex test is there so you can get rid of the other heavy hitters to get the system calmed down, I think you're fine to go that route. Best ways to limit excess estrogen. 2-week detox. I like the paleo cleanse, the veggie cleanse from Designs for Health, but I know Metagenics has a cleanse, and I know Core Restore is a cleanse through Ortho. I like the paleo cleanse. It's easy, or now they call it the veggie cleanse. It's easy. They're not caloric restricted. Patients do very well on that. So if I do a saliva test that I see the estrogen's elevated, I run a 2-week detox, bring them back, see where they are. If they just perimenopausally have low progesterone symptoms, then I'll just add a little bit of progesterone until they get into the kind of menopausal state of now I got to add estrogen. And then you can use, if you've got somebody that needs a little more support and you don't want to put them on you can't keep them on that either, have them do the detox a couple days a week. Like, I'll have some people do a shake Monday and Thursday, or some patients love it. They do it for breakfast 4 days a week. I also use Estradim by Orthomolecular, or Estradim CDG. The CDG is a little expensive. Maybe do a month of that, because the CDG has calcium deglucanate in it which is going to help your beta glucuronidase. So if you've got somebody that's a real bad offloader, maybe give them estradiol CDG for a month. Be careful. If they're a terrible offloader and you give them 2 CDGs, they'll feel terrible. So you may have to gently go up on that also. Then go to plain estradiol. It's a little more affordable for the patient. You can use Dim-Avail from Designs for Health. That's a little milder. It's probably not going to give you as big a kick as the other. And Xenoprotect by Zymogen. Those guys are also good for that perimenopausal offload lady problem. And you're going to have some people that in order to get enough estrogen into the brain and drop the estrogen and detox the estrogen. So again, get the estrogen high enough that the brain's happy, but then detox it. Some people, you don't want to do a full detox, but maybe postmenopausally, you give them their hormones, but then you just give them an estradiol every day or every other day, and that helps balance the estrogen. Slides, I think, yes, A4M is going to send. And then butyrate. So here's my deal with butyrate. Enterovite, I think Apex makes, and that's butyrate. The only problem that I was taught is that the small intestine is so aggressive at absorbing, because I was taking Enterovite for a while as a postmenopausal woman. I take glutathione, and then figuring my free radicals are up. I work on my digestion. I take my hormones, and I was taking Enterovite. Apex has shown pretty significant improvement. Like they gave a rat, I think, irritable bowel, and then they gave some the butyrate and some they didn't, and they found it cleared up with the butyrate. Some people say that the butyrate gets absorbed in the small intestine. How much is getting into the actual small intestine itself? We don't know. And by the time you get down to taking butyrate, the patient's already on so much. So I'm like, oh, it's one more supplement to take. I've talked to some of the people at PCCA. What you really need is like almost a butyrate suppository. I don't know that too many people are going to sign up for that. So do I think it's great? Possibly. Is it kind of low down on my list? Probably. But I think it's a good point. I think if you get the gut in line, you get the probiotics and the prebiotics down there, I think that you'll hopefully make enough butyrate that you can get rid of one less pill. Speaking of migrating motor complex, do you recommend prokinetics? If so, which one do you recommend with SIBO patients? I think we don't use a lot of prokinetics. I think SIBO patients are very difficult. Probably about a year or two ago, Chris Kresser did on Revolution Health Radio, he interviewed a gastroenterologist, a functional gastroenterologist, who had just done a study where they were biopsying SIBO patients. And what they found is half of them or 3/4 of them didn't have SIBO, but had more diversity problems. So they didn't have increased intestinal overgrowth. They had diversity problems. So how SIBO is SIBO, who knows? And I can't remember, there's another guy, and I can't remember who's the leader in the field. I heard his podcast the other day. I can't remember who it is. But now they're coming up with even more of a breakdown with SIBO. And I think patients love to throw that SIBO word around, and they love to turn around and say, oh, I blew hydrogen, or I blew methane. I think that if you get the gut in line and get the person digesting, and honestly, the migrating motor complex and secretory IgA don't work in the light of dysfunctional cortisol. I think if you ask these people what their job is, how their sleep is, how much downtime they have, are they doing yoga? Are they meditating? I think if you work on that, and I think that is underappreciated. People are very quick to go adrenal fatigue, take supplements. What do I do here? Take supplements. I think if these people would eat better, do a little bit of intermittent fasting, find some peaceful downtime, and you do, say, your GI map and work on your gut, I think that you will, no problem whatsoever, get rid of that. In other words, get rid of the SIBO as best as you can with gut healing, and I don't think you need to use prokinetics. I don't use postbiotics either. I think you'll make your patient nuts. I see too many people come in with a practitioner that they've seen just with this shopping bag full of supplements. And in doing that, they're not worrying about their diet. They can't. So I don't. I'm a big food person. In Houston, we have a Central Market. That place always gives me anxiety because there's so many people and stuff there. But I go in the morning early Sunday, and I take my cell phone and I look at all the weird stuff. And the more weird plants I can get down. And Dr. Krishnan will tell you from Microbiome Labs, go to an Indian food store, go buy a dragon fruit. So the more, go to an Asian store. So the more you can do to really vary your gut, the less pills you'll have to put down. What about the IgG for dairy sensitivities? I noticed food sensitivities for dairy went up with colostrum IgG, even though I was attempting to heal the gut. Will serum delivered IgG be better? And have you had any experience using that? I have not. I have not used serum IgG, serum derived IgG, and noticed a difference. I think every company has a difference of why they think their IgG is less inflammatory. I saw that when I was at one of the expos at one of the A4M meetings. One company said, well, they use egg and we don't use egg. And I don't know that makes a big difference. I've seen the same thing with whey. There are people that can tolerate whey protein that don't really have massive dairy issues. And there's people that have dairy issues and can tolerate a little bit of whey. I think that you got to wonder if there's a inflammatory sensitivity and you're sending something down a little bit more aggressive. Is that going to elevate that? So in that situation, maybe go real low level. I would look at the mega mucosa because it's got a very small dose of everything by Microbiome Labs. And I think Dr. Krishnan would tell you drink that slowly through the day. And that's going to give you support of the lining while you're doing a little bit of the IgG removal. And I think that those tough people will have a better time. So do I like saliva hormones? The big thing that I am learning with saliva is that the problem you're going to have is that, and I learned this from the lab PhDs, is that when you are looking at salivary testing, you're looking theoretically at free hormone, which is tissue level. So that is going to give you an idea where this lady is on nothing as she walks through the door. And that's why I use it a lot in that perimenopausal-ish woman, because sometimes you'll see massively elevated levels to detox before you put her on hormones, or somebody that's low across the board, you can start her. The problem I think that we were finding is that the saliva is one of the first places that the hormones go from the tissue that you rub it in. So you rub it in, right? The way the hormones work is that they're attached to nanoparticles, and the 5-micron nanoparticle is the optimal level particle. So the compounding guys attach the estrogen or the testosterone, whatever you're going to use, and it goes into your system, and you rub it real hard in one place. The literature says rub it in one place over and over again because it's going to increase your diffusion gradient. Rub it for at least a minute. Don't rub it all over the leg. Rub it right in. It's going to go through the stratum corneum and stratum, whatever all those layers are, the 5 layers of the epidermis, and then it's going to get into the bloodstream and the lymph system. The lymph system will carry it right up to the salivary glands. So you're going to get, unfortunately, elevated levels even when your tissue levels are low. So I think you get a false elevation. And we used to use this for a long time, and that's why I think we were underdosing patients. The other problem you have with saliva is there's no clinical correlation with somebody in their younger age, because if you look at the levels, they're just looking at levels. If you use Access, they'll say, okay, a premenopausal saliva level is between 0.5 and 5, but postmenopausal treated is greater than 5. Well, why do I want to be higher postmenopausal? I want to be closer to Judy 47.5. Because you got to drive the salivary levels through the roof, and then you don't even know where you are tissue-wise. So I think we used it for a long time. There are some people that still believe in it. I like the urine test. So it's Rhein, R-H-E-I-N Labs, and I like the urine test because it makes logical sense to me that your level is going to be, if you look at Judy 20s, Judy 30s, and Judy 40s, now what's happening? The cells are look around and go, okay, now there's no estrogen. Okay, I guess I need to inflame and I can't have a baby anymore. No reason for me to be here. And Mother Nature takes you out. So to me, at least now I've got some kind of data point. I've done some of my own epigenetic looked at my own kind of methylation parameters. And it would be really cool to be able to look at where somebody is methylating, like what level their telomeres or their DNA age is. and then give them hormones and see if we can reverse it and find the optimal place there. Problem is those tests are still pretty expensive. So I don't use saliva to track anybody. I think you're going to get levels that aren't great. We used to use saliva, and that progesterone cream looked like it worked, and that's why uterine cancer increases. I don't use progesterone and cream at all anymore. I only use capsules because I know I get uterine protection. So it's a long answer, but I think I would be very careful about salivary treating patients, but you can use it to start with. The favorite GI test lab we use is Diagnostic Solutions. GI map, but I found that, like I said, Microbiome Labs just came out with a new test. They partnered with somebody. We use the GI map. I tend to like that a little bit better, but I did the microbiome test because I torture my kids, and my kids and I do one of everything. So either one of those, and then you'll find which one you like better. They're both really good tests. Somebody asked if I'm happy to talk to providers. I don't charge a consultation fee for providers. I try to help people. I'm just trying to change the world. So I'm happy to talk to anybody that wants a little bit of time to kind of learn a little bit more. I do not use estrone sulfate in blood for a baseline. I use estrone in the salivary test. So my baseline blood is TSH, I call it hormone blood. It's TSH, free and total testosterone, FSH, LH, DHEA, sex hormone binding globulin, estradiol, progesterone, if I didn't say that already, and pregnenolone. And then a lot of times I'll get thyroid with that, and then I just do the whole thyroid panel, the free T3, free T4, reverse T3. But I don't get estrone. I will pair that with the salivary test because I'm not hung up in estrone in the blood. I want to know if her estrone's elevated in her saliva, then I know she's not detoxing. I do use collagen. We use Orthomolecular's collagen. I have my folks on that. I use that a little bit in the coffee in the morning. The urine lab is Rhine, RHEIN. And if you Google Rhine Labs, it'll come right up. If I do blood, saliva, and urine at the same time and lower on saliva than blood and urine, that goes against what you're saying. How do you explain that? If I do blood, saliva, and urine at the same time and lower on saliva than blood and urine, lower on saliva than blood. No, that's not true. Because if the binding globulins are up, you're going to find, okay, let me read that again. If I do blood, saliva, and urine all at the same time, and it's lower on saliva than in blood and urine, that's going to go against what I'm saying. So I got two answers for that. Number one, there's an old paper, and I'm happy to send it to the person that asked this. It's an old paper that was done where they took women and they sat them in a room for 24 hours, and they did every hour, they did progesterone, they were luteal phase, and they did a blood stick, and they did a saliva spit, 8 o'clock, 9 o'clock, 10 o'clock, 11 o'clock, and it was pulsatile. It was the whole time was pulsatile. There's no consistency. So believe me, I have biohacked my body and tried to do every combo I can. I'd love to do 2 24-hour urines at the same time. It's physiologically impossible. But I think if what will happen is that if you're going to spit and then you're going to go to LabCorp and they're going to draw your blood, you're going to get pulsatile differences. So I don't know that you can see low here and a little higher in estrogen or progesterone in blood, and you can make that correlation, number one. And number two, what's going to happen is that and in urine, you're getting a whole 24 hours as opposed to a simple collection. And number two, if your sex hormone binding globulins are elevated, that's going to bind the estrogen and you're going to see less in the tissue. And as you're getting close to menopause, it's like the ocean current going out. You don't have as much steady flow of estrogen. So you'll have a flood, a period, and it's out again. But I don't think you're going to get as much tissue penetration. And if you get a flood and those binding globulins are elevated, which happens if you draw those, that you'll see, what's going to happen is that the system is not going to have as much in the tissue. So you'll see low saliva and you'll see blood and urine that doesn't necessarily 100% have to correlate. So I think just doing this over and over again, the problem I have with doing urine initially is if my estrone is low normal, it can look a lot worse in saliva, and I'd be more aggressive detoxing that person than I would if somebody had their normal estrone in their saliva. I don't know if this is a repeat if I said this. So the urine test lab name is Rhein, R-H-E-I-N labs. What lab do you find has the best pricing for your serum hormone panel? I run it through LabCorp Quest. As an MD, we use the patient's insurance. So I run my basic stuff through LabCorp Quest. We use Access as our salivary lab. I think you get the most bang for the buck. I don't get hung up on cortisol because I think you fix the person, you fix the cortisol, but a lot of people are very hung up on that. So it's nice for them to see it. So it gives me estrone, estriol, estradiol, DHEA, testosterone, progesterone, androstenedione, 17-OHP, AM and PM cortisol. So you get a lot of bang for your buck. So if you do my biopanel and the Access in that irregular period person time, what you'll find is that you'll see a good bout. You'll be able to kind of treat the patient. You'll know who you got to detox, and you'll know kind of what you got to do most optimally. Do I got to detox her first before I give her hormones? She had a period, 2 months ago. So now I got an FSH. Or somebody that says my hormones are a problem and they're 47. Again, her FSH is normal or it's elevated, but she's making estrogen and her detox is up. So Access is going to, with your LabCorp or your Quest Blood, going to give you a good combo. I don't use peptides for hormonal support. That is I am probably one of my weakest areas. I'm going to do more of the peptide study. I haven't had a chance to do those courses as much. My big disconnect I find with hormones is that we don't understand as physicians, we don't understand the pharmacokinetics behind it. And it was too long somebody telling me just do this or just do that. So I've spent the last year and a half studying the pharmacokinetics behind estrogen replacement, trying to figure out the best way to at least figure out where the basic people are. And then peptides potentially will be the next road. But understanding what you're prescribing when you're using hormones, I think is a big key that'll help connect physicians to make them better prescribers. And my favorite micronutrient supplement company, we use a lot of orthomolecular, we use a lot of Designs for Health, we use Biocedin is more for the toothpaste and the other stuff. We use Zymogen, I use a lot of Zymogen's OptiMag. I probably use mostly Designs for Health and orthomolecular, but we do use a bit of Apex also. And I think it's just who you fall into. It's sort of who you like. And then if the rep is good, and most of them make very, very similar products. We use a little bit of biotics, but I tell people we're not married to anybody. As soon as something new and good comes out, we try it. Or I'll make my kids try it. And I'm like, if you guys die, it doesn't matter, you're my kids. So I hope I answered everybody's questions. And anybody's still there, have a good day.
Thank you so much, Dr. Ginsberg, for a wonderful presentation. I'd like to invite the attendees to join us this weekend for our Lab Fundamentals program. You'll learn from our experts what labs to use, when to use them, and how to interpret. Lastly, you can learn more about women's HRT in our upcoming 2-week course with Dr. Tara Scott and Dr. Sarah Gottfried. You can use code webinar100 to save $100. And Dr. Ginsberg, thank you so much. We truly appreciate you and all you do.
I'll send out the glycemic index thing, and I'll put my email on that when you can send it to everybody.
Fantastic. We will send that out tomorrow with the recording. Thank you so much, Dr. Ginsberg.
Good, everybody. Have a good day.
Thank you. Bye-bye.